Hey everybody, I'm Laurie-Marie Pisciotta, Executive Director of the Mental Health Association. I'm here today with a very special guest, Representative Joseph McNamara. Representative McNamara is the chair of House Health, Education, and Welfare Committee in Rhode Island's General Assembly, where he represents parts of Cranston and Warwick. Representative McNamara is also the Mental Health Association's Mental Health Legislator of the Year Award recipient for 2020. Normally, we would honor Representative McNamara at our May is Mental Health Month kickoff event at the State House, but unfortunately, we can't do that this year. So we're doing the next best thing, which is capturing an engaging conversation with the representative and listening to his thoughts about mental health and the COVID-19 crisis. So Representative McNamara, thank you so much for joining us today. And again, congratulations on your award.
Well, thank you very much. It's an honor to be here, and certainly the award reflects the commitment of my colleagues in the House to mental health and ending the disparities that exist in the mental health field.
Yes, thank you so much. You've been a wonderful champion over the years for the mental health community, and we're really grateful to you. You've sponsored many pieces of legislation touching on mental health in Rhode Island. And can you talk a little bit about why mental health is important to you?
Well, Laurie, as a career educator, having spent 37 years in an urban environment, primarily at the secondary level, I became very aware of the importance of mental health and learning, and also very aware of the stress that my students were under and the importance of having good clinical services to support them. Because unless a student is addressing those issues, no meaningful learning will take place.
That's absolutely true. Very insightful. I feel like that's true for everyone, particularly young people in a learning environment, but all of us need to tend to our mental health before we can tend to other areas of our life.
Absolutely. And especially during these times, Laurie, the inquiries and phone calls that I've going back over these past 2 months have been incredible in terms of the stress that people are under and some behavioral and mental health issues that tend to present themselves when people are outside of their regular routines. It's been very difficult.
Absolutely. I share in that. Before this crisis began, what were your mental health related legislative priorities for the 2020 session of the General Assembly?
The greatest priority that I had this year was the Mental Health for All Students Act, which would, and this is very innovative, increase the number of school social workers and psychologists in our schools, especially core cities and urban schools that are under financial stress, by using federally reimbursed Medicaid payments to support them. Now, social workers in particular are very valuable due to their training. Approximately 10 years ago, we did a survey of 16 social workers in an urban setting, and we asked them to monitor the referrals that they had for 1 year, 180-day school basis. And those statistics were alarming, but they represent the needs of our kids in today's society in terms of referrals for suicide prevention, substance abuse. Many students are on medication. Luckily, social workers today are trained in basic pharmacology, so they can see when very often students have conflicting doctors and prescriptions.
Mm.
So it was a real wake-up call for me that these needs were being addressed at a time when people were thinking about cutting back on social workers because they weren't considered essential. So this legislation would allow school departments to increase the number of psychologists and social workers without impacting the local budget. And when a student comes into school and says, "Oh, I witnessed a domestic violence incident last night," or traumatized, they're not going to learn at the same level. Also, I've co-sponsored legislation that would enshrine the Affordable Care Act and ban the discrimination on pre-existing conditions. So those pieces of legislation are very important, especially in light of the current administration in Washington.
Absolutely. Absolutely. Those are just two examples of many, many examples of your steadfast support for mental health and not just mental health, but social determinants of health that you've been a really great champion for. And we appreciate the hard work that you're doing there. You're fighting the good fight. And Mental Health Association, for one, has testified in favor of these pieces of legislation that you mentioned, and we'll be there again next session when you meet again.
Well, thank you. And something else that I've realized this year, Laurie, we have a complete package of bills dealing with Alzheimer's. And when we talk about disparities in chronic illness, something that I was made very aware of was the fact that individuals can be diagnosed with this chronic illness and there is no care plan. Basically, they're told, well, you're going to start to lose cognitive ability, physiologically, you're going to deteriorate. And when you get to such a point, then we'll address maybe some hospitalization or placement. It should be like any other chronic illness. And if someone went in with cancer and they had a diagnosis that was fatal, and the doctor said, well, we're just going to wait until you get worse, and then we'll address the issue. I mean, that's just wrong. But it's one example of a chronic illness and the disparity between what physical ailments and mental and psychological ailments.
Absolutely. That's a perfect example of that disparity. Yeah. In any given legislative session, there are competing priorities, right? Because we have a state budget that has a limited amount of funds in it. And every legislative session, you have lobbyists representing the common good as well as special interests, and you have so many competing priorities. How does the General Assembly negotiate or balance or weigh the competing priorities between things like, for example, housing, which is a social determinant of health? Because without housing, we can't be physically healthy, we can't be mentally healthy, we can't learn in school. How do you weigh things like housing with the need to balance the budget, and what are those conversations like behind the scenes?
I think the conversations start with how can we fund the basic operations of state government, and specifically, how can we address the basic needs of individuals in our community that need assistance from the state. We look at taking care of various communities that have needs, the developmentally disabled, people that rely on us for housing, assistance, the basic needs of life. So it's like kind of backfilling. Let's take care of the basic needs that government has to address. And then let's look at ways that we can invest that will help prevent situations from getting worse for individuals. And funding education adequately, and especially healthcare. And we've learned during this epidemic that we are relying on people to take care of very fragile populations, put their lives on the line, and we're paying them less than $15 an hour.
Mm.
I mean, if you talk about heroes, go into a nursing home and see who's working there. And these people are not, it's horrendous. So I think we've seen some systemic needs that everyone says we have to address these. So that's kind of a flavor of the conversation.
Yeah, that's terrific. Thank you for sharing that. I suspect there will be some different kinds of conversations, deeper conversations about these very issues as a result of COVID-19, where it highlighted some of the problems that we have nationally, not just in Rhode Island.
Right.
And that it'll shine a light on things in such a way that hopefully this will be the beginning of some positive change
Right.
that would not have come about without the crisis.
And I think we have to look at things creatively as well. I mean, sometimes we can't just mandate that individuals be given more money if the money's not there. But I have a piece of legislation this year that I look at as kind of a creative solution, particularly to help CNAs. There is a shortage now in Rhode Island hospice alone of 30 CNAs. Dementia care units are having difficulty hiring CNAs. Our nursing homes today, we have the National Guard and working with them. One of the pieces of legislation that I have is to reward CNAs that work in some of these difficult areas with credits for CCRI to take classes to advance their degrees and certification and training and clinical training. And the idea is if you have a class with 10 students that could be 15, then these individuals can audit those classes and the cost is minimal, but the payback for training individuals clinically is great. And to me, we have to be creative, but we also have to address this difficult situation.
That's a very interesting idea. As chair of the House Health, Education, and Welfare Committee, which is a very important committee on the front lines of all of these important issues, can you tell us a little bit about what you're hearing from your own constituents related to the COVID-19 crisis?
Immediately at the beginning of this, I received 3 or 4 phone calls that were very interesting from families that had members that were on the adult members on the autism scale. All of a sudden, they had their adult children who were in structured programs at home, and there were big issues. So we connected them with resources in the community, and I would advise all of the viewers to write down this number. It's BH Link, Behavioral Healthcare. It's a 24-hour hotline, area code 401-414-5465. And they got referrals that they needed. The other situations were, and this is at the beginning, calls from seniors. One individual he was in for rehabilitation. His wife was in a nursing home, and they're calling from rehabilitation and nursing homes, and they can't understand why they can't be together. Very difficult to explain this disease is going on. Calls from parents who had children in group care settings, homes and settings for individuals with developmental disabilities were all of a sudden told you can't visit your child. How will we know they're well? Why? So it was a lot of listening and explaining. And then people just calling up that are depressed, and sometimes you just listen. Last week I got a call from a woman who's 93 years old, and she lives alone. Her son, I saw her son leaving the house, and I said, "How's mom doing?" So she called me and basically talked to me for about a half an hour. Very interesting. But so people are out there lonely, they have questions, but I think there is an overall anxiety that people have that tends to manifest itself in the morning, just getting up, and not people that don't have a routine. They're kind of anxious about what they should be doing. They miss going to Dunkin' Donuts, stopping by their regular morning routine. And anytime you take someone's routine away, there's anxiety, and they overanalyze things and can lead to depression. So behavioral support services are very important in this crisis. And the anxiety and stress, one way to deal with it, I think, is, talk to your neighbors, realize you are not alone. That's what I tell people. You're not alone. We're all in this same boat together. And give yourself a break. Have patience and grace. And hey, I told someone about a month ago, I said, well, this reminds me of being in high school again. Gas is cheap and I'm grounded. So, and really, and giving yourself a haircut. I mean, hey, who hasn't given themselves a haircut before? It's like college. So I think that we just have to give ourselves that room, and also, take up, read that book you haven't read, and, sit down. And there's nothing wrong with binge watching Netflix. I think, I don't know. So, but I think you just have to take it easy. People have to take it easy on themselves, and try to enjoy, cooking, learning new recipes. I mean, I've gone from reading recipes to watching videos of chefs. It's much better to watch the videos, and I have to admit the internet has been really great. It's improved my repertoire of cooking, of recipes. So, there's some of my hints that I've been talking to people. Plus, the latest, and I'll just give you 3 examples of businesses. One, businesses that bought business interruption insurance have been denied. I know what that's about because I've owned a business, a couple of ice cream shops, and I had that insurance twice, and in both times applied and was denied. One time a water main broke out in front of my business, denied. The other time was Hurricane Gloria. My ice cream shop was shut down for over a week, lost about $5,000 worth of product. They said it's not covered. So they're denying all of these claims for business interruption insurance. So I drafted some legislation up that I'll be submitting relating to that. I have friends that are co-hoggers out here in Warwick. They are devastated by this. The wholesalers are not buying their products because the restaurants are closed. At one time, they were told that they could sell directly their clams and quahogs to residents, which is great because you get quahogs and clams the same day they're dug by one of your neighbors, and you can have a regular standing order wonderful idea. And then they were told, no, you can't do that. But yet lobstermen can sell their lobsters at retail. So I wrote to Director Coit and said, I believe it's a form of discrimination based on stereotypes that are very old and inappropriate of who made up this population of commercial shell fishermen. Today, they are educated entrepreneurs that work very hard, and they're also very concerned about food safety and protecting the health of their consumers. So I think some of these, so right now we're in a battle to get them going. And, the restaurant industry in general. So I think that, we really have to work and listen to people. And another one was two women that own a small boutique gym, large space on Route 2. They put a plan together where everyone gets fitness checks, health checks when they come in. They're socially distanced apart. There's no group communication and no hands-free entry. It was a great plan. And they're waiting to hear from the Department of Health. And meanwhile, they're paying rent on a large facility. But I think some of those simpler things that seem easy are causing a lot of anxiety for different populations. So I've been very busy working on these issues as well as some of the mental health issues.
Yes, I can see how complicated all of these matters are. That I'm not a business owner, so I don't think about these things, but it seems all very complicated and
Yeah.
yeah. As part of the General Assembly's leadership, can you talk about how the General Assembly has been dealing with the COVID-19 crisis, and when will they meet again? And when they do meet again, what will that look like in terms of social distancing?
The Finance Committee is meeting this Thursday, and some of the members will be meeting virtually. The chairman will be at the State House. The House Lounge is one of the larger rooms where individual representatives that are there can have separate spaces. And our discussion so far, when we come back in probably the next several weeks to do the budget and other pressing issues, it will look a little bit like the United States Senate. I envision representatives sitting remotely in offices through their building, alone with their computers. They'll be called up to the floor, probably in small groups, Group A, 15 minutes to check in. You'll see 10 or 12 representatives come up, press their button and leave. Group B, then we will have issues that are presented. In this case, it'll be articles in the budget that we vote on individually. There'll be a few individuals on the floor. I would envision Chairman Abney, Majority Leader, Minority Leader, some debate. If someone wants to debate, they come up to the floor, press their recognition button. So a process that would normally take maybe 5 or 6 hours will probably take 3 days, maybe 18, maybe 20 hours. But the objective will be to keep everyone safe. I think we might see access to legislators limited, whereas, Laurie, you walk on the floor and it's loaded with lobbyists and, not exactly an ideal situation for social distancing. So the public will probably be able to view everything in the galleries at each end of the chamber. But I think unfettered access to representatives unannounced, I would think would be limited during this time. What it looks like in the future, I don't know. I have been conducting, I chair the New England Board of Higher Ed, and I conducted our spring meeting. It's like a 5-hour meeting with several votes taken virtually on Zoom. And it was interesting, this new world that we live in. You know, a senator from Maine, Portland, Maine, she's sitting in our living room, and we had a finance chair in Connecticut who was giving a finance report from his kitchen, and his cat hopped up on the kitchen table, and he said, "Hey, I thought this was a cat-free meeting." So, you know, you really get some insight into, you know, how people live, and, you know, of course, their children are there. And, you know, last week we heard the Supreme Court was probably the toilet flush that went around the world. So, you know, it's Zoom and things happen in the background. But I think that in many ways it could be a new reality for people. And like any other technology, it's something that we're all learning. So you have to, again, be patient. We're going to make mistakes, and be forgiving of yourself and others.
Absolutely. Is there anything else you'd like to say to Rhode Islanders right now?
Just be safe, be patient, and take it easy on yourself. And remember the BH link, and there are many, many other resources available on the Department of Health COVID hotline. Please don't hesitate to ask for help. That's why we are here, your local officials, and we realize that this is a time of need for many people. And please don't be afraid to ask. And thank you very much, Laurie. I appreciate this opportunity. And I also appreciate the work that you do and the professionals that you represent. It's very important to the mental health and the overall health care of our citizens. So thank you very much.
Thank you, Representative McNamara. It's been a pleasure to speak with you today. Congratulations again, and I look forward to the day when we can see each other in person at the State House.
Absolutely. Thank you very much.
Thank you so much.